Welcome students. Today I am going to take anatomy of pancreas. Pancreas एक नया चैप्टर है अपने लिए. क्लास में हमने नहीं पढ़ा था, बट अब ऑनलाइन क्लास में हम पहली बार ये चैप्टर ले रहे हैं, तो थोड़ा धीरे धीरे समझाऊंगी और थोड़ा ध्यान से समझना. ओके. Pancreas, first of all, where it is present and how it looks. Just have a look and what are its parts. हम एनाटॉमी में जब भी किसी चीज़ को डिस्क्राइब करेंगे तो हमें पता होना चाहिए कि वो चीज़, वो ऑर्गन या वो स्ट्रक्चर क्या है, कहाँ है, किस रीजन में प्रेजेंट है, उसकी साइज़ क्या है, उसके रिलेशंस क्या है. यानी उसके एंटीरियर में क्या होता है, पोस्टीरियर में क्या होता है, राइट में, लेफ्ट में क्या है, या फिर मीडियली क्या है, लैटरली क्या है, अगर उसका शेप क्या है, उसके बॉर्डर्स कितने हैं, उसके सरफेसेस कितने हैं, उसके पार्ट्स कितने हैं. फिर हम जाएंगे उसके हिस्टोलॉजिकल सेक्शन में, उसके फिर फंक्शन में. तो इस तरह से हम वन बाय वन हमें कवर करना चाहिए. अचानक पूरा चीज़ पढ़ने से आप सब भूल जाएंगे. इसलिए लेट अस स्टार्ट विद द pancreas. Okay, now see how the pancreas looks like and where it's present. Now you can see this yellow structure. This is pancreas. Am I clear? This yellow structure. Now this, we have made a section here. This was the stomach, pyloric part of stomach. Clear? And this is the beginning of duodenum. First part of duodenum, second part of duodenum, third part of duodenum, fourth part of duodenum, and then you can see a fold over here. This is duodenojejunal flexure. That means fold between duodenum and jejunum. Okay, so this is the end of duodenum and this is the beginning of jejunum. Clear? So we can see very clearly the duodenum is C shaped, and in this C shaped we can also see two openings here. This is first opening, this is the second opening. The first opening is called, this is very small in size, isn't it? Can you see it? Very small. This is minor duodenal papilla, and this is a bigger one, so it is called major duodenal papilla. And now you can see one more structure here. This is fusiform gallbladder. So this is the body of gallbladder, the fundus of gallbladder. Okay, then this is the neck, and then this is the bile duct, common bile duct. Common bile duct, which is now joining the pancreatic duct and opening here in the major duodenal papilla. So you can see this pancreatic duct, it is also joining the bile duct, and then it is opening, and because these two are the big ducts which are concerned with the digestion process, so the opening in which they are opening is also large in size, so it is called major duodenal papilla. So this is the major duodenal papilla, and now this you can see, this is the head of pancreas, this is neck of pancreas, this is body of pancreas, this is tail of pancreas. I think this much is clear to you. Now let's go to the next slide. Now you can again see the pancreas. We have dissected the pancreas over here, and you can see its duct, isn't it? It is arising from the tail, and it is receiving its tributaries from both upper and lower side almost perpendicularly. Clear? So this is the duct of pancreas, and here it is joining the bile duct, and now again in the second part of duodenum you can see it opening in the major duodenal papilla. Clear? Now we will have to now describe what kind of organ pancreas is. So it is a soft lobulated elongated gland. Okay, it is very soft, it is lobulated, you can see lobules are present, and elongated. See, it is long in nature, isn't it? Elongated gland, and is having both exocrine and endocrine function. This you must have studied in school itself, that that pancreas has got both exocrine and endocrine function. Exocrine glands are which glands? Which have got ducts to take their secretion, and endocrine glands which are ductless glands. Clear? So it is both endocrine and exocrine. Exocrine part is secreting the pancreatic juice, and you must be knowing from the school itself that pancreatic juice, it contains all the enzymes which have to digest both carbohydrate, then lipase for the digestion of fat, then there is trypsin for the digestion of protein, isn't it? Amylase for the digestion of carbohydrates. So all the structures of the food material has to be digested, and the major digestive enzymes are going to come from the pancreatic juice. So this exocrinal part of the pancreas is secreting pancreatic juice. Now endocrinal part of the pancreas, you must be knowing it has got alpha, beta and gamma cells. Alpha cells, they secrete glucagon, that is a hormone. Then beta cell, they secrete insulin, and you know insulin lowers the sugar level in the blood, whereas glucagon increases the sugar level in the blood. And delta cells, they secrete somatostatin. Okay, so the pancreas is soft, lobulated, elongated gland with both exocrine and endocrine function. Now, as I've told you, in anatomy, we have to know where that particular organ or structure is located. So, and we know also that the pancreas is situated in abdomen. Abdomen is divided into 9 parts. On the right side, upper right hypochondriac region. On the upper left hypochondriac region. In between both is epigastrium. Below the right hypochondrium is the right lumbar region. Below the left hypochondrium, left lumbar region. Below the epigastrium, umbilical region, which contains umbilicus, isn't it? You know the umbilical cord, the cord which joins the fetus to the mother, or the placenta, you can say. So that is umbilical region where the umbilicus is present. Below the right lumbar region is the right iliac fossa, and below the left lumbar region is the left iliac fossa, and below the umbilical region, hypogastrium. So these are the 9 regions of abdomen. So where is pancreas located? You can see this here. This is the diaphragm, and you can see esophagus coming out from the esophageal opening of diaphragm. So from here the stomach is going to arise, and this is the first part of duodenum. You can see the cut portion. So here the stomach will end. So this portion, we have removed the stomach so that we can see the pancreas more clearly. So this is definitely present here behind the stomach. So the first region that it occupies is the epigastric region, and the next region it is going to be located in is near the spleen. Where is spleen? In the left side, extreme upper left. That means left lumbar, left hypochondriac region. So the pancreas is situated in the epigastrium and left hypochondriac region. Behind, and then it is going to be present behind the stomach. As I've told you, we have removed the stomach so that we can see the pancreas. Okay, so it is situated behind the stomach and the lesser sac, and its situation is transverse. Can you see? It is quite transverse in location. So it is present transversely across the posterior abdominal wall, because it is behind the stomach. So you can see it is near the posterior abdominal wall, not near the anterior abdominal wall. So it is present transversely across the posterior abdominal wall at the level of L2 and L3 vertebrae. So what is the level according to the vertebrae? L2, L3 vertebrae. Okay. So this is the position. Two regions it is occupying, epigastrium and left hypochondriac region. Then it is lying transversely at the level of L2, L3 vertebrae. This is clear? Now, what is the size and what is the shape of pancreas? You can see it is in J-shaped, right? It is J-shaped or retort shaped. Length is 15 to 20 centimeters. So this length is 15 to 20 centimeter. Not much. Okay? 15 centimeter is just 6 inches, isn't it? So it is not very long. 15 to 20 centimeter. Thickness 1.2 to 1.8 centimeter. So neither thick. It is quite thin organ. Breadth is 2.5 to 3.8 centimeter. So breadth is 2.5 to 3.8 centimeter. And you all know 2.5 centimeter is 1 inch. So it is neither very long, neither very thick, neither very broad. But its function is multidimensional. It is both exocrine gland as well as endocrine. And you know, insulin is so important for our function, our body function. If there is a deficiency of insulin, a patient gets a disease called diabetes mellitus. And what is the weight? 90 grams. Okay. So it is not a big organ, but it has got a big function. Not a function, many functions. Now, again, I will repeat all the parts of this organ. Okay. Very simple. It's very simple. See, this is the C-shaped area formed by the duodenum. First part of duodenum, second part of duodenum, third part of duodenum, fourth part of duodenum. And this is the beginning of the jejunum. Clear? So, here this blue color you can see, this is nothing but head. Head of pancreas. Okay? Head of pancreas is lying in the C-shaped concavity formed by the duodenum. And in the lower part and near the fourth part of the duodenum is uncinate process. Okay? Uncinate process. Then this small green portion that we have made. See, this is not the natural color of the pancreas. Let me make it very clear. These colors are only used to explain to you different parts of the pancreas. So this narrow region you can see is the neck of pancreas. Then you can see this is the body of pancreas, and this yellow color, this is the tail of pancreas. This tail of pancreas which is reaching the spleen. So it is beginning from the duodenum, the C-shaped concavity formed by the duodenum, and reaching the hilum of spleen. Okay. Now you can see after neck there is an elevation here. Okay, in the body. This is the body of pancreas, and there is an elevation on the superior border just after the end of neck. This is called tuber omental. Clear? So these are the parts of pancreas. Clear to everyone? Now we talk only about head. See, I will tell you in short and what is important for you and what is easy to remember. Okay? So the head. First of all, we are going to talk about what are the borders or surfaces of the head and the relations of the head. Okay? Only what is important for you. See, head is enlarged part, C-shaped, lying within the concavity of the duodenum. It is C-shaped because it is lying in the concavity, isn't it? C-shaped concavity, it is lying in the C-shaped concavity. So it is C-shaped in structure. Now, how many borders it is having? 3 borders. How many surfaces? two surfaces and one process called uncinate process. This is the uncinate process. Three border. You can see this is the superior border, this is inferior border, and this is the right side. So this is the right side of the border. Otherwise you must be thinking तीन बॉर्डर है, सरफेस दो कैसे? तीन बॉर्डर इसलिए क्योंकि एक बॉर्डर है राइट साइड की बॉर्डर विच इज लाइंग ऑन द concavity of the duodenum. That is why we are having only two surfaces, anterior which you are seeing right here, and posterior, that is the behind portion. Okay, so it has got three borders: superior, inferior, right border. Clear? Two surfaces. This is the anterior surface and posterior which is behind it. And uncinate process, this is the uncinate process. Clear? These are the parts of head. If you have to explain the head of pancreas, you have to explain like this, that it has got the shape. What is the shape? C-shaped. Then it has got three borders: superior, inferior and right border. And it has got two surfaces, anterior and posterior surface. One process, uncinate process. Clear? Very simple. Now we come to uncinate process. Just now I said uncinate process is the process of head. So we will talk about uncinate process. We should know where it is lying and what is its importance, right? It is a triangular projection which arises from the lower and left part of the body. Here it is arising here, right? It is triangular in shape. So it is triangular projection which arises from lower and left part of the body. This here and relation. See, now this is the uncinate process. If you remember the previous one where we had not shown any artery, here you can see one artery and one vein also. And what are these arteries and veins? Nothing but superior mesenteric artery and superior mesenteric vein. Okay, because GIT, it's divided into three parts: foregut, midgut, hindgut. Foregut is supplied by celiac trunk, the direct artery of the abdominal aorta. The midgut is supplied by superior mesenteric artery. The hindgut is supplied by inferior mesenteric artery. Just remember these three arteries and everything will become very clear to you. The blood supply of each and every part of GIT will be very easy for you to remember. So, its relation. Anteriorly, it is related to the superior mesenteric vessels. So obvious, isn't it? Superior mesenteric artery, superior mesenteric vein, both are present anterior to the uncinate process. See, we cannot see the uncinate process clearly because these two artery and vein are coming out, isn't it? So the anterior, very simple, anterior relation is superior mesenteric vessels. Posteriorly, aorta. Obviously, because this superior mesenteric artery is arising from the aorta. This is the aorta. It is present posterior to the pancreas itself. So posterior to uncinate process alone. If we talk, we are talking right now only about uncinate process, and you can see from here that aorta is present posterior to the pancreas. So the uncinate process also is related posterior to aorta. And above, superior to it is left renal vein, which we cannot see from the front. Okay, it is present behind, but it is present above the uncinate process. Neck. Now we just talk about the neck. Neck is present after the head. This is the head. This is uncinate process. This is neck. This is body. This is tail. So this neck, anteriorly peritoneum is present, which is covering the lesser sac. See, we have lifted up the stomach, and that is why we are able to see this portion. So this neck is covered by peritoneum covering the lesser sac, and this portion. What is this portion? Pylorus. So anterior relation of neck is peritoneum covering the lesser sac and pylorus. Is it clear? Anterior relation of neck. Now we talk about the posterior relation. So anteriorly, this is the anterior aspect, but if we look from behind, this is the posterior portion, okay? We are looking at the pancreas from behind here in this lower diagram. And what are we seeing? We can see this is the superior mesenteric vein and this is the splenic vein. Both of them, they join to form the portal vein. But here we are concerned with a very narrow region called neck of pancreas. So neck of pancreas is posteriorly related to superior mesenteric vein and portal vein. Superior mesenteric vein and portal vein. Is this clear? Very simple. Anteriorly it was the superior mesenteric vessels and posteriorly it is this. Anteriorly it was related to the peritoneum of the lesser sac and the pylorus, and posteriorly to the superior mesenteric vein and portal vein. Body. Now we go to this portion, the biggest portion of the pancreas, that is the body of pancreas. Okay, body of pancreas, it is the elongated part. It is elongated, isn't it? So obvious. It extends from neck to tail. This is neck, this is tail. So it is extending from neck to tail. It passes towards the left side with slight upward. You can see it is upward. It is passing towards the left with slight upward and backward inclination. It is passing transversely upwards and backwards, isn't it? Because it has to reach the tail, and tail will end in the hilum of spleen. So this is the location of body. Body is triangular in cross section. If we take a cross section of the body, it is triangular. So it has got three borders: anterior, superior, inferior. Okay, three borders. And what is important is it has got tuber omental, which I said in the beginning. I had showed you just when the neck had ended and body had started, the superior border, it had an elevation, and that was tuber omental. It is a small projection on superior border, little to the left of the neck, isn't it? The left side, that side. Clear? That is tuber omental. We can leave this. Surfaces, anterior surface, it has got anterior surface, inferior surface. Now here, relations of the body. Body is related to what? All structures. Because I've told you we study anatomy in detail because we should know what are the structures we are going to find if we are going to dissect or we are going to operate someone. And if there's a problem, a patient is telling a problem of some area, we should know what are the structures present in that particular area. That is why we should know the relations. So now first of all, posterior surface of body. It is related to aorta, left crus of diaphragm, left kidney, everything is left. See, every structure which is present on the left side is on this because on the right side was the head of pancreas. Then came the neck of pancreas. And now the body is going towards the left side, towards the tail and the spleen, isn't it? So everything is left to which it is related. Except for the aorta, then left crus of diaphragm, left kidney, left suprarenal gland, left renal vessels, then finally splenic vein, because spleen is going to give out a vein which has to be known as splenic vein, isn't it? Now we come to the tail. The last structure of pancreas is tail. Left end of the pancreas, it lies in lino-renal ligament together with the splenic vessels. Splenic vessels means splenic artery, splenic vein, both. Now you will say, what is lino-renal ligament? See, there are two ligaments, gastrosplenic ligament and lino-renal ligament, which are attached to the hilum of spleen. Lino is representing nothing but spleen itself. So the ligament between the spleen, hilum of spleen and left kidney is called lino-renal ligament. And the ligament between the stomach and spleen is called gastrosplenic ligament. So here it is present, the tail is present in lino-renal ligament. Inside it, isn't it? Together with splenic vessels, they are also present there. Why? Because lino-renal ligament is attached to the hilum of spleen and the tail is going to end in the hilum of spleen. It has got an impression, the hilum of spleen has got impression for the tail of pancreas. That is why both the vessels, splenic vessels as well as the tail of pancreas is lying in the lino-renal ligament. Then it is related to the lower part of the spleen. Okay, and lower part of the spleen is called gastric impression. Now we talk about, we have now seen the parts of pancreas: head, uncinate process, neck, body, tail. Okay, we have seen the borders, we have seen the surfaces, we have seen the relations of all these parts. Now we are talking about the ducts, the duct of pancreas. Okay, that is very important. So as I have said, pancreas was exocrine gland as well as endocrine gland. So endocrinal portion, alpha, beta, gamma, delta cells, they don't need duct system, isn't it? They are going to pour their secretion directly in the blood circulation, but the exocrinal part requires a duct system. So there are two ducts, but the main duct is this that you can see, which is arising, which is starting from the tail end, see, and receiving its tributaries almost perpendicularly. This duct is coming down here, it is enlarging here, and then it is joining the bile duct and opening in the second part of duodenum, and this is called major duodenal papilla. Then you can also see one small duct here, a thin one. This is called accessory pancreatic duct. It is also opening here before this. So this small duct is opening in the minor duodenal papilla. So there are two ducts, main pancreatic duct as well as accessory pancreatic duct. Now, main pancreatic duct is also called duct of Wirsung. Clear? So if someone asks you what is duct of Wirsung, it is nothing but the main pancreatic duct. So main pancreatic duct that you can see here, which is joining the bile duct and opening here in the major duodenal papilla. And see, the importance of this portion is that this is actually the junction of foregut and midgut. That means before this, all the portion is foregut, and beyond this, it is the midgut. We are not talking about the hindgut, because midgut and the hindgut, the junction is present in the transverse mesocolon. Right 2/3 and left 1/3 portion of the transverse colon. You just see where that junction part is present, and that portion is called the junction of midgut and hindgut. So this is the main pancreatic duct or duct of Wirsung. It lies near the posterior surface. It is 3 mm in diameter. It is white in color. It begins at the tail. It is beginning at the tail. It runs throughout the body. See, it is running throughout the body. This is the body. It is running throughout the body. It bends at the neck. This is the neck. It is bending here. Bends at the neck to run downwards and backwards in the head. This is the head. So it is running downwards and backwards in the head. And the herringbone pattern, the ducts, the tributaries are showing herringbone pattern. You can see it more clearly here. This is it is white in color, and this is the herringbone pattern. You can see this. So I'm again repeating the same thing. It is lying near the posterior surface of the pancreas. It is white in color, as you saw in the previous slide. It begins at the tail. It runs to the right side. This is the right side. This is the left side. Bends at the neck. This is the neck. It is bending down. Runs downwards, backwards, and to the right in the head. It is starting from the left side, ending on the right side. Now, in the head of pancreas, it is related to the bile duct. This is the bile duct, isn't it? So this is the head of pancreas. Here it is related to the bile duct. The two ducts open in the wall of second part of duodenum and join to form hepatopancreatic ampulla of Vater or major duodenal papilla. And what is its location? It is present 8 to 10 centimeters from the pyloric end of stomach. This you have to remember. The pylorus means the pyloric end. This is the pyloric end, and the beginning of pyloric end of stomach ends here, and this is the beginning of duodenum. First part, second part, third part, fourth part, and this is jejunum. Clear? Now, we also said there were two ducts, main duct and accessory duct. So the accessory duct is called accessory duct of Santorini. So this thin duct is called duct of Santorini or accessory duct, and it is going to open in the duodenum. And what is that opening? I have told you, minor duodenal papilla. And what was the distance of major duodenal papilla? 8 to 10 centimeters from pyloric end of stomach, right? And this has to be 2 centimeter before that, because it is opening, this accessory duct is opening before the major duodenal papilla, isn't it? Before the main duct. So this is lying 6 to 8 centimeters from the pyloric end of stomach. Clear? So now again I will repeat the whole thing. It begins in the lower part of the head. It is beginning here in the lower part, okay? It is going to start like this. You are seeing only this portion, but actually it is starting like this. So it starts from the lower part of the head, crosses the main duct with which it communicates. It is communicating here, but actually it is starting from here. It is crossing this main duct. After communicating, it is then opening here. Opens as minor duodenal papilla in the second part of duodenum, and the area, the distance is 6 to 8 centimeters distal to pyloric end of stomach. That means this is opening 2 centimeters before the major duodenal papilla, or the accessory duct is opening 2 centimeters before the main pancreatic duct. Arterial supply of pancreas. Splenic artery. You can see this is the splenic artery. It is giving perpendicular branches here, and this one, a large branch, this is nothing but dorsal pancreatic artery or pancreatica magna. This artery is also called pancreatica magna. So its main blood supply is from the splenic artery. So the body and tail are supplied by splenic artery, which are giving so many pancreatic arteries. Clear? And what is the source of splenic artery? The source is this celiac trunk, and celiac trunk was the artery of foregut. So because that means this portion of the body and tail of pancreas are representing the foregut, because they are supplied by the artery, splenic artery, which is giving out pancreatic arteries, so many, and pancreatica magna also. All these are the branches of splenic artery, which itself was a branch of celiac trunk. So we are left now with the neck, head and uncinate process. Here you can see this celiac trunk has given one more branch here. This was common hepatic artery, which gives off one hepatic artery, which is to supply the gallbladder as well as liver. And one branch is coming down. And what is that? Gastroduodenal artery. It is again dividing into two parts, anterior and posterior pancreatico-duodenal artery. But which one? Because it is present on the superior portion, superior. So superior pancreatico-duodenal artery. So you can see it is also giving branches to the head of pancreas. And now this is the superior mesenteric artery, means the artery of midgut. It is giving a branch here. See, you can see very clearly, which is again dividing into two, one dorsal, one anterior or ventral. This is pancreatico-duodenal artery again, but we had talked about superior pancreatico-duodenal artery here. So this was superior pancreatico-duodenal artery. So this has to be inferior pancreatico-duodenal artery, and both are anastomosing, and you cannot even see what is the junctional point, isn't it? But you can say very clearly what must be the junction point. Major duodenal papilla, because major duodenal papilla was representing the junction of foregut and midgut. So that is the place where these arteries are going to anastomose. So they are also giving pancreatic branches. So the head, neck, uncinate process, they are supplied by the superior pancreatico-duodenal artery as well as inferior pancreatico-duodenal artery. Clear? Venous drainage. Now here this blue color you can see. Blue color is always representing the veins. So venous drainage is from the splenic vein, and this is the superior mesenteric vein, and both of them join together to form the portal vein. So the venous drainage is from splenic vein, then superior mesenteric vein, and finally the portal vein. And portal vein is going to open in the liver. Portal vein will give 80% of the blood supply reaching the liver. Don't forget this. Now, nerve supply. Parasympathetic nerve supply by vagus nerve. We know the 10th cranial nerve is the vagus nerve. It is parasympathetic nerve. So parasympathetic nerve supply is coming from the vagus nerve. Sympathetic nerve supply is coming from celiac and superior mesenteric plexus. Plexus means network. And secretion is also controlled by hormone secretin, which is a pancreozymin. So venous control is also there over the secretion, parasympathetic as well as sympathetic, but hormonal control is also there over the secretion by the enzyme secretin. Lymphatic drainage. See, every organ has got an arterial supply, a venous drainage, lymphatic drainage, nerve supply. So we have to talk about the lymphatic drainage. Lymphatic drainage, you can see here so many lymph nodes and so many lymphatics, but finally you have to understand this was the celiac trunk, a direct branch of aorta. So the lymph nodes near this celiac trunk are to be called celiac lymph node. So all the lymphatics or the lymph nodes which are draining from the foregut region have to finally drain in the celiac lymph node. This is superior mesenteric artery, which was the artery of midgut. So all the lymphatics or the lymph nodes which are draining the area which is formed by the midgut, they have to finally drain in the lymph nodes around this superior mesenteric artery. So these lymph nodes are called superior mesenteric lymph nodes, and these are called celiac lymph node. Now just let us see which lymph node is draining which area. Head and neck are drained by pancreatico-duodenal lymph nodes. Head and neck is going to be drained by, this is pancreas, this is duodenum, so pancreatico-duodenal lymph nodes. Body and tail, now this is body, this is tail, now it is going towards the spleen. So body and tail is drained by pancreatico-splenic lymph node. And efferents, that means as I have already said, the efferents will go either to the celiac lymph nodes or superior mesenteric lymph nodes depending on the area. Applied anatomy. Applied anatomy, this is the last portion that we have to take. There can be congenital anomalies of pancreas. There can be trauma to the pancreas. There can be infection or inflammation of pancreas, which is called pancreatitis. It can be acute, it can be chronic, both. Mostly found in alcoholics. There can be a tumor. Carcinoma is present everywhere, we know, so many people, they have pancreatic carcinoma, and it's very difficult to diagnose it because pancreas is present behind the stomach. And the procedures means the surgeries that we can do on the pancreas. Okay, so I think you must have understood the anatomy of pancreas. Thank you.